signs of diabetes, okay? Early signs of diabetes. How do I know I have diabetes, right? I look normal, I feel normal, but what's the problem? And you might do a blood test, and it might not be that bad, just a little bit over, but that's with the laboratory. But how do you know you have diabetes? Interestingly, some people, one of the signs of pre-diabetes or diabetes is some people will get darkening of the neck, some dark spots. It's called acanthosis nigricans. It's a very high pigmented area in the neck. Most of the time it's in the neck, here, in this, and other parts of the body, axillaris, but mostly in the neck. You see that in some of the young people that are very overweight. They're already beginning to become diabetic. And the thing is that they're producing too much insulin. So one of the problems we have with pre-diabetics is that sometimes all the tests are normal. The sugar level is normal. And how can you have pre-diabetes and have a normal sugar, right? Well, the reason is that your pancreas is still working. That's why you're not fully diabetic. If the pancreas was not working anymore, you'd be completely diabetic. But so the pancreas still works, but it has to produce a lot of insulin because people that are overweight have insulin resistance. Very important to know. That means that our body does not respond well to the normal insulin that we produce. We become resistant to it, so the body has to produce more. The pancreas has to produce more and more insulin to do the same amount of work. You understand? So if the body becomes resistant to the insulin, we need more insulin so that it can stimulate the body enough to utilize the sugar that we have. That's the main problem with diabetes. We become insulin resistant, and we can become insulin resistant as we get older, just old age. As we get older, it happens. As our muscle mass drops, our muscles drop, we become more resistant to insulin. And we get older, our hormones drop, especially in men, testosterone drops, so we become more sensitive, more resistant to insulin. If you have higher levels of testosterone, that decreases the resistance. It's good for the body. So there's certain things like that. So again, pre-diabetic, sometimes it's hard to tell. Now, if you're becoming diabetic, you start going to the bathroom, you start voiding a lot, peeing a lot. So people void a lot more urine because the blood gets thicker, so you get thirstier, you drink more water, and then you pee more, you void more. These are very important things. And sometimes they're settled to say, well, I have to go to the bathroom 6 times a day. I used to go only 2 times a day. Might not be a lot, but those can be some of the early signs. Most diabetics, before they become diabetic, most of them will have gained weight. And they say, I used to be 130 pounds, I'm 160 pounds, and that's probably one of the first things you notice. Okay? So if you have any questions, just come by, get a test. Nowadays it's easier, just get a blood test. We do the A1C, hemoglobin A1C, and that tells us how the sugar is in the red blood cells, which is it's a better test. It's a better test for that. Okay? Thank you.